Good morning or good afternoon, everyone. Thank you for joining us for this Cybersecurity and Healthcare, How Safe Are We webinar. My name is Kenan Rooney, and I'm going to be the facilitator today of this webinar. Just some housekeeping initially. We are being recorded. Submit any questions or comments that you have via chat. I'll be consolidating those or maybe interjecting with Lynn and Todd during the presentation. There is one CPE credit available for this session, and you need to participate for the duration of this webcast. And there are polling questions, so answer at least 3 of those polling questions, which we'll have during this presentation. And then you will receive via email your CPE certificates. There's also will be a survey forwarded after this webinar. And again, so any questions that you may have, please bring them up through the chat. Our presenters today, you can see them on the screen. Todd Gower, he's the Vice President of RGP's Healthcare organization, and Lynn Rowland, who's actually in our risk and compliance organization, that's the cybersecurity and data practice leader. And so I'm going to let them introduce themselves, and then afterwards they'll go through the agenda and we'll start the presentation. So Todd, I'll hand it over to you.
Oh, great. Well, no, I'd give ladies first. So Lynn, if you want to go, you can.
Sure. You might want to, there's a little bit of feedback too that you might want
to. Oh, there is. Okay, thank you.
Sure. So I'm Lynn Rowland and I lead RGP Cybersecurity, Privacy, and PCI compliance practice. And I've been with RGP for about 5 years and I'm based just outside of Washington, D.C. I have a Big Four background, Deloitte's Cyber Risk Services practice. And before that, I stood up Booz Allen's Privacy and Data Security practice and ran it for about 15 years. So let me ask my colleague, Todd, to give his brief introduction, and then I'll kick us off on our agenda.
Great. I apologize for the feedback. I'm calling in from France on this. And thank you, Lynn. My background is a states here in our overview, Big Four experience as well. And then also working in industry with large health systems, integrated health systems, one as an IT compliance officer, and secondly, working in overall IT governance and controls. And then at a point in time working with CMS as the RAC leader and special projects for CMS. And then with their DC consulting firm before joining Ernst & Young and RGP. So nice to meet everybody. Thank you.
All right, well, that's a nice segue into our agenda. First, we're going to take a look at how the cybersecurity threat landscape has evolved over the past year or so. Todd's going to share with us how some organizations are adhering to the HIPAA Title II for IT security compliance. We'll walk through some of the trends and risks that we've seen in the past 6 to 12 months that are actually based on the audit results that my team and I have performed. Next, Todd will share some insights on FDR IT-related risks. And then we'll wrap up with today's discussion with some conclusions about just how safe are we in the healthcare sector and perhaps provide some key cyber takeaways. So the cyber threat landscape. All right, so it's been about 20 months since the pandemic hit and it resulted in the largest remote workforce in history. On the next slide, we know that it caused a lot of traffic on networks and, for some, their bandwidth issues just imploded once the lockdowns went into effect. Most notably, IT departments didn't have enough time to set up their employees remotely, at least to the degree that they would have liked to or that was necessary before everybody was sent home. So why is that important? Well, because for one, it manifested into many of the audit issues that we've seen over the past year, and I'll be able to highlight some of those a little bit later. But these are issues that we still see IT departments grappling with to resolve. So if the task of bringing all employees online wasn't enough, the scramble to do so, I think, created the perfect storm by 3 things. One, enabling this work from home strategy. A lot of people didn't have it in place, right? Maybe just the onesie twosies that work from home, either part-time or on occasion. The second was the re-engineering or retooling. business models, like how are companies going to take their products and services to the marketplace in light of a pandemic, right? And then the rush to deploy new technologies. We didn't have, I don't think, Teams at the time, and we were just, some of us were getting Zoom rolled out. And so, you know, when there was a rush to do that, you skip a couple of steps with new technology. So as a result, we saw a 600% spike in email phishing attacks between 2019 and up till now, and 139% rise in ransomware attacks. And these trends are continuing. We don't see it really any let up anytime soon. One of the recent studies that among many that I looked at revealed, a very recent one, that despite the pandemic and all of these increases, 1 in 4 organizations haven't given cybersecurity training to their employees. And I think another interesting study that I read this past summer, at the end of the summer, Palo Alto Networks found that 50% of organizations that suffered a ransomware attack were actually paying the criminals. And you know, I can understand why in some cases, right? Because for some, paying the price was much faster. They were, you know, more swiftly able to get back online and resume their business. I mean, it was, and for some, it was a less expensive option. So the average ransom incident, just as an FYI, yields about $312,000 for each criminal incident that occurs. Next slide. So from a healthcare perspective, you know, cyber criminals didn't have to do much. They didn't have to come up with any, you know, new or clever alternatives for capturing healthcare data or other disruptor, you know, enabling other business disruptions. Mostly because this work from home created such a virtual playground, right? It enabled them to exploit a lot of the vulnerabilities of payers, providers, third-party administrators, and the criminals have been relentless. You know, a study like 2 or 3 years ago, University of Maryland revealed that networks incur a cyber attack every 39 seconds. And that I noted on the previous slide. But really now in 2021, they have found in the first half of 2021, it's now every 11 seconds. So it's no surprise that, you know, back in 2020, over 500 healthcare providers were victims of these ransomware attacks. The pandemic essentially created an epidemic of cyber crimes across the healthcare value chain. And so some threat actors now have become, well, they're using these so-called ransom as a service type of initiatives. This RAS is where cyber criminals are developers of ransomware. They become third-party vendors, if you will, and they're making their money by taking a percent of the profit of their client who buys their product, this RAS product, and breaks onto an IT system or network. So whether it's to hold the information captive for ransom or to steal personal data and other information, or just simply to disrupt the business operations, RAS has become pretty popular. Ransom as a service. The next slide. I'm going to just briefly go through some of the bigger attacks. Most of these everybody's familiar with, so I'm not going to spend much time on it. But SolarWinds was the worst cyber assault in our government history. Discovered about this time last year, December 2020. Gang, backed by Russian, nation state of Russian intelligence, penetrated multiple parts of our federal government. It was the supply chain attack on SolarWinds Orion software update. And because it impacted probably 18,000 different companies, that and the fact that it took about 8 or 9 months before anybody realized that cyber criminals were lurking around in all facets of our federal government, siphoning information. We also saw a disruption to our energy consumption. Many of you back in May remember the Colonial Pipeline hit by Ryuk with a $5 million ransom attack. I don't know that they paid the full $5 million. I don't know that what they did pay, how much that they may have gotten back. Some of that information was revealed, but some of it couldn't be validated. Then we saw REvil, this hacking gang that attacked the global food processing company, JBS. The operations in the US and around the world affecting our food supply. Then it got really personal, right? $11 million ransomware. And then finally, we saw Kaseya, global IT infrastructure provider, suffered an attack from REvil's ransomware by an automatic update that Kaseya, which is like a IT management and software company. Kaseya put out their virtual system administrator, VSA software, and there was a vulnerability that was exploited. REvil mandated $70 million in ransom, and Kaseya told them, they can go pound sand. They apparently were able to obtain the computer key or universal decryption tool from a trusted third party. And so they didn't need to pay the ransom. I don't know all the details. I don't know that there's a whole lot of details out there online, just that this occurred and Kaseya is saying, no, we didn't pay anything, not one red penny. So that's kind of cool. On the next slide, I'm sorry, not the next slide, Ken, just back one. Lastly, more recently in the last 2 or 3 months, HHS released a threat briefing warning that Lockbit ransomware, a hacking group that attacked Accenture a few months ago, has their latest variant, Lockbit 2.0. It was released in June 2021, and it acts as like a double extortion crime. It uses steelbit malware to encrypt networks. Anyway, you can find more of that online. I would encourage you to read more at HHS's HC3 website. You can get more details on that. So for now, I'm going to take a break, and I think we have a polling question.
Yes, everybody, thank you. You should see this polling question on your screen. Let me that polling question. Just the question: has your organization experienced a successful cyber attack in the past 12 months? Unsure and no.
Interesting. Okay. Very fortunate for the 40%.
Mm-hmm.
Unsure. That's very interesting.
Yeah, interesting. Great. HIPAA IT security?
Yeah, great. Can you guys hear me okay?
Yes.
Great, thank you. Go to the next page. Yeah, so when we think about HIPAA and IT security, they typically work in tandem, right? So you're thinking about privacy issues, but then also the IT impact. Aside from the paper trail that can occur on a HIPAA review or a process review at a health system, be it a payer or provider or doctor's office in the hospital system, there's a number of things to consider though during these IT security reviews. And what we found principally with the health systems, there have been a number of failure points. And one of the things about is that the provisioning of access, understanding the rules themselves, and then the overall enforcement of it, and really getting to the point of helping individuals and organizations understand what can be very complex in their entirety, but simplifying them so folks understand what to do, what not to do. And the point of this slide is, our view on trying to simplify what we've been seeing with some of the health systems and delegated entities, from health plans to providers. We're even working on other integrated health systems, what the compliance should be. So for those who may be new to to this. They may understand HIPAA in general. But one of the things when you think about an IT security, what Lynn mentioned earlier, all those things that can occur can also impact your organization from a HIPAA perspective. So, thinking from an integrated health system or academic medicine, when one in particular was hit by ransom, what the effort was to remediate that, one. Secondly, think about the potential data breaches that occur there. And do they actually have good controls in place? So if a ransom event occurs, making sure you've got some fail safes and contingency plans that exist that can support, one, the potential breach. Secondly, quell any or squash any efforts of those individuals using the information because it's highly encrypted, and good luck trying to decrypt that. So there's a number of things in place that you want to think about in developing your HIPAA compliance space. Next page. So as I mentioned earlier, same thing at EDI, right? So this is a quick polling question to help with that. And I don't know if for those who have experienced this is a lot of fun. Go ahead and choose which one you want to look at.
Right, there we go. Which one is EDI? There you go, Todd.
Very good. So from reviewing that, so it means that a number of you may have heard EDI being used. And if you're unsure, that's okay too. I think that's where you get to the point of, okay, let's understand this a little better. When you think about the data being transferred, data being at rest, data being used, all the protocols that are in place, particularly around the information that's being transferred, be it a claim system or someone's medical record, really knowing what it is that's being transferred and how's it being transferred, make sure the proper protocols in place. To Lynn's point she made earlier, IT security is not just a department or a bunch of guys giving you provisioning of access. It boils down into the area of looking at the various bits and bytes that get transferred along its chain of custody. So from admission of an individual at a hospital or urgent care or outpatient clinic to membership data. So, and membership actually working with their clinician or with their PBM or with their delegate entity, all that data, that individual needs to be monitored and that there's proper controls in place, right? So thank you. We'll go to the next slide. And I'll let my esteemed colleague Lynn talk more about the trends and risks.
Sure. Thanks, Todd.
You're welcome.
As part of the trends and risks, we want to share what we've seen, it just at a high level through audit findings and observations that we've performed, some with ratings, some without, over the past 3 to 12 months. And that was based on, again, what we saw that I mentioned earlier, that was, I think, in large part, not exclusively, but mostly the result of having to scramble to put in place a lot of the infrastructure, both hardware and software, needed to enable work from home. And we're going to take a look at 4 sectors, and I'll go through them pretty swiftly just to give you the salient points, right? But the reason why I'm doing that is because these are not necessarily unique overall to each one of these sectors. They can be certainly applicable to healthcare, or all of them applicable to the entertainment sector. But it's worth sharing so that you can get some idea, starting first with the retail sector. We saw organizations whose growth exploded either due to acquisitions in recent years for some, or in one particular one, it was like a hockey stick in growth as it related to online sales. They did phenomenal due to the pandemic. It was an athletic apparel company. That said, in either case, whether it was due to acquisitions or online sales, neither of these companies had really kept pace with the growth of their IT security investments and cybersecurity business needs, that side of the house. So, things like perhaps adopting an identity and access management strategy, or implementing technology like a platform like SailPoint, All of that to help managing identity access or credentialing for those who are accessing the network. The causes for this, we saw constrained resources within the IT departments that really slowed the progress down for implementing roadmap strategies, things that they knew that they had to put in place back in 2018, 19, and they plan to do that in 2020 or 2021. As far as the healthcare space, what we saw predominantly and continue to see is a lack of standards or processes for evaluating and monitoring third parties and vendors. That seems to have been the primary. Secondary is having kept pace with policies and procedures and documenting operational practices. But my colleague Todd can speak more to what he is seeing there. But in particular, we found vendor access credentials to IT systems and applications that either weren't revoked or maybe there was too much access. Also the monitoring and managing of contracts, SLAs, MSAs. Many were unable to demonstrate their due diligence of actually evaluating or monitoring third-party risk management. Some have, maybe not to the degree that they should have. Others, they're still struggling with just getting a VRM strategy in place and then all the tools and the people to be able to execute against that on a routine and consistent basis. There was also, a lack of contractual language. Contracts in the healthcare sector have gotten better about stipulating, expectations around data privacy. Not so much have they kept pace with the cybersecurity and the IT expectations. And so there may have been just a few bits and pieces, but that really needs to be built out more from what we had seen from some of the clients.
Yeah, and if I could piggyback one more thing on that. Yeah, so we've seen too, to Lynn's point, the need for good IT security personnel supporting these health systems has been a struggle for a number of companies. And I know Lynn and I can attest to this because we're trying to look for individuals to support us in our client discussions and needs. But even when we get to the site or even work with organizations, some of the CISOs, the Chief Information Security Officers or IT security leadership has been thinned out, either to go into private industry or they just the stress of it all can be daunting, right? And so a lot of them just kind of get out and go back into maybe base programming or doing something else. But we are seeing this bit of a trend in the healthcare sector where it's just becoming so much based on, to Lynn's point earlier, about protecting against ransomware, ransom attacks, or even just the normal attacks that are happening within the healthcare space. And so that continuity of understanding of the rules, the regs, the policies and training education has been really constrained or put to the test, if you will, as we've talked to a number of provider groups and delegated entities from the health plan space, where it really has put a big strain on the overall IT security space. And so I think even with the best laid policies and best laid training programs in place, the individuals who deliver that have been challenged to make sure they've got individuals that could actually perform that. And they've maybe, as Lynn and I have seen this too with some of our clients, they bring on someone, okay, can you code? Yes. Okay, now you're an IT security person. Well, that is not the right answer. So even having the credentials themselves, it takes a number of years to really become proficient in that. So it's not an instant grab a certified person and it's fixed. It does take some time to really make sure these programs are really in place, hence the reason why the trends are occurring in both the retail and any of the industry sectors in the United States right now. Thank you, Lynn.
Thank you. That's great. Moving to the next slide. Yeah, in the hospitality sector, things that we saw included a lack of control owners being identified for things like hardware management, managing software assets, let alone just having a control owner identified to either remediate something or to track certain controls around cybersecurity or data privacy. And where newer technologies or applications were rolled out, not all had documented policies or procedures about their use and access rules. And so that was pretty problematic, because if somebody was let go due to a cut, which we saw quite often in the hospitality sector, doing more with less people, that institutional knowledge walked out the door with it. And nothing was really documented well enough that somebody else could succeed and fill that role. Like I said, COVID had a crippling effect on the hospitality and leisure sectors in particular. And so many organizations had to reduce that staff. And that was pretty much the primary cause of that. I think they had a lot of the technology. They had, again, most of what they needed in terms of an infrastructure in place. They just didn't have enough people to run it and monitor it. On the financial side, and I don't know if you wanted to add anything to that Todd, before I moved on to the
Yeah, no, I mean, having been in that business before and knowing some of my friends in the hospitality sector, especially in Europe and Asia Minor, and also in all of Asia, we're not alone in the space. So again, controllers, hotel controllers are being responsible for IT security who may not have that background. And so at the localized level, where they're extremely vulnerable for certain attacks versus the corporate organizations. Yeah, to Lynn's point, thinning was actually occurring a lot, and they just had to do with less. And I think very similar to the hotels, to hospitals, we saw that across the board in a lot of industries. So yeah, hospitality and hotels, I'm sorry, hospitality industries and hospitals were not alone in this impact of COVID. So.
Yep, thank you for that too. On the financial services side, I was surprised to see that data protection and regulatory compliance continue to be one of their chief challenges. We worked with a number of financial services company over the past year performing internal audits, and whether that was working with the internal audit department or lines of businesses who was saying, hey, before IA comes around, can you look under the hood and kick the tires for us? Do an audit, but it'll just be non-rated. Tell us where we're probably going to come up short. So we would do things like that. Our observations included IT security controls that seem to be designed effectively to mitigate reoccurring data instances. So in other words, there's a lack of controls that were either modified or even noticed that they weren't working. And that was chiefly because of the data showing all the incidences that had occurred. And an incident was not necessarily a breach, but then there were some breaches. But the same incident kept occurring over and over, and the controls weren't adjusted or addressed. The lines of businesses that hadn't taken time to understand the recurring types of these incidences, along with specific types of training and awareness being prescribed by law that hadn't been integrated into their learning management system. Those seem to be the biggest problems. Interestingly enough, though, in one case, a really large, very well-known insurance company with over 30,000 employees had what I thought was the master plan of training for privacy, security, whatever it was, regulatory compliance. They had multiple training modules, very impressive. They were delivered, training was completed on time, it was tracked, there were metrics, it was brought up to the board of directors. I mean, all of that. Very impressive dashboard for reporting and showcasing to leadership. But the training itself didn't seem to be very effective for the reasons that I stated earlier. The same data instances kept reoccurring over and over. And in another instance, the right type of training was provided, but to the wrong group of individuals. who, the people who were handling certain types of data didn't get the training that they needed. But another group was, and it was kind of falling on deaf ears. So it was very interesting how that was rolled out. So it was ultimately course corrected, right? But, the causes included outdated controls, the lack of design and operational effectiveness. And I would also say that it was a lack of mapping risks to controls to regulations. So not only are you demonstrating that you have, identified a risk, you've established a control that you think will address it, but then you can also use that control to demonstrate your due diligence and compliance. I think finally, what was very interesting too about some of the financial services companies is controls were spread across multiple departments, even within the department to multiple people. So you could look at one control and there'd be like 15 different people who are responsible for it. And you think, well, that sounds great. However, no, because accountability was so diluted that you couldn't really find who was responsible for it. Everybody was pointing in different directions. So that made it a little bit more difficult. And of course, the recommendation is like, you need to streamline that. It's great that you have 5 different departments and 4 people in each one responsible for this one control, but you really need to tighten that up a little bit. Ironically, what you're finding then on this one slide, and then we'll move on to the next, is that there were too many individuals identified in the financial services example of control owners, but not enough in the hospitality sector, right? On the next slide. All right, we have a polling question.
Yeah, next polling question. And just a note, a little bit past the bottom of the hour, Todd and Lynn. Polling question number 3, what is your biggest IT/cybersecurity concern given the current landscape? People/skill sets, A, existing/lack of processes, B, C, enabling technologies and tools, and D, all of the above. Yeah, thanks everyone. All of the above.
Well, good.
Yeah.
It's fascinating to me, the cybersecurity and IT market right now for candidates, extremely tight, extremely competitive. So with that, I'm going to turn it over to my colleague, Todd.
Thank you. And actually, nice segue. When you think about vendor management and vendor relations and that downstream related entity, that seems to be a recurring issue we're seeing with a lot of the audits from state audit agencies and CMS. Take the next page. So when you think about the oversight requirements regarding your vendor relationships, especially in the payer space with your delegated entities or IT organizations, and I think as Lynn touched on with these contracts with these vendors, be it whether it's a physician group or whomever, I think the most important thing is revisiting the controls around what they're prescribing to. We had their own third-party audit that goes on to make sure their IT controls are in place, along with making sure they do protect the data that's being given to them, reviewed by them on your location or at your location of your members, in this case for payers, which is really critical for you as a payer conversation. But also from the hospital conversation, as you work with your payers, make sure the information is truly clear and crisp, because what's going to happen is that there'll be folks like us coming in, or folks from my past days at CMS saying, okay, take a look at your overall management of information of your members and their quality of care, and then also look at the data that's how it's being done. So what we're finding is that there has been a lot of poor oversight, and I think it touches on what Lynn mentioned earlier, is just that the competition for resources is really tight. A lot of health plans and payers are struggling with this. Even not the big guys that to some extent may be having a little easier time because they can have folks transfer in from other departments, but the smaller community-based health plans, or maybe it's a single state health plan, are struggling with this a little bit. And we know that the problem is not just the training controls. It gets down into the IT pieces. And what we're finding is that, as I mentioned earlier, with the review of these delegate entities, their own IT controls are failing. They really are. And it's not because they're doing it nefariously or anything else, or they have poor controls. It's just the individuals are running it or reviewing it are really struggling with making sure they've got the right consistency of understanding and review. Because you had one review 6 months ago and you supplied information, then you have another follow review, that same information is not relevant. Maybe from a policy standpoint, it's an annual review, but the data and logs and everything else that goes along with that, it's not. So when you think about the ongoing risks that we're seeing within FDRs, first year downstream related entities, it gets back into that first, second, third line defense, that operational piece where your operational leaders are working closely with that. Then it gets into the compliance people, the monitoring programs that exist within payers. And then also the monitoring program from on the second line defense on the provider group side, working closely, making sure they walk that through. And then of course, the third line defense with internal audit and external auditors, making sure those controls are being monitored and there's a proper risk program to really assess whether or not there's an efficacy of an FDR program. I go next page.
Todd, quick question for you. All these lines of oversight, you talk about first layer, second layer of all this stuff. Curious if you or Lynn could give insight of what is it then that allows the penetration into by these ransomware or other organizations. I mean, yeah, if someone had the secret answer to this, that would be great. But are you sharing initially that it's because people were transitioning in their roles and there wasn't proper?
Yeah, I think
is that punchline here?
Yeah, that's a good question. I think what we're seeing when related to IT security, because you have poor FDR oversight, doesn't mean you're going to have instant IT security problems. You might have really good delegated entities or vendor entities that have really good controls. They have a SOC 2 they passed recently, or they got high trust certifications on their systems. And you go and do your tests, and we're in pretty good shape with our member data. But it gets down into, okay, they have a homegrown system that they've developed that doesn't have a lot of these controls in place. They think they have a really good system, and they've got a number of connect points that have gaps in them because they haven't been updated for quite some time. Or in the case that what Lynn and I found with one particular client from a provider group, that they had failure points where they just haven't put in the general security controls, like patchware. So that gets down into really understanding the basics of what those high level controls are. That's where people like Lynn and myself, especially Lynn, especially in her area as an expert in the space, can really help just at high level due diligence, if you will, to make sure those controls are in place, and asking those basic questions of your delegated entities or your vendors to say, what do you have in place? I mean, you can look at the standards, and I'm not going to bore everybody because I know Lynn and her group could go through the quals around what needs to happen within the IT security space and down to the detail of those provisioning controls. But at a high level, what do you have in place? And having done this for quite some time ago, even when we're first doing it in my days at a very large integrated health system, just understanding what are your key controls, what are those key applications. And we found, in talking to a number of delegated entities, they didn't understand their key applications. They knew that they had a system that recorded the members' admission and their records, but they didn't know that there are other ancillary systems. So really understanding your architecture, especially in healthcare, what is touching that patient, what's touching that member data points is really key, and what vendor is actually touching it too. So I'll pause there, and I'll let Lynn, if she wants to add anything more to that, she can.
I think on the next slide, I get into a lot of what might help. Oh, no, that's yours. Sorry about that. I'll answer it here in a slide or two. How about that?
Okay.
Well, I won't duplicate myself.
Yeah, no, that's okay. And I think you're seeing a theme here, right? So it's and to Lynn's point made earlier, having good people, having a plan in place, having a strategy that you execute against, a roadmap to make sure it's not just a point in time, it's an ongoing process. And it's not compliance's responsibility. It's the operation and leadership responsibility. It's the board's responsibility too, to understand they got these controls in place. So maybe many of you on the phone might be chief compliance, chief risk officers, or chief whatever regarding the risk governance control management might be, or your IT security officers. I think the thing to consider is that there are mistakes that happen. No one's completely perfect in space. So we are seeing that risk assessments, they look pretty on the page in a book to present to your leadership, but they really need to be proactive, not just one time a year, but they're followed up on, and making sure they've got the proper review. And we're finding this out on one particular client I have that's going through this process now, getting a more robust and not saying, okay, we've got 500 risk areas. What are the key areas to focus on? They have good management preparedness against that to really feel they have the right projects to mitigate the risks on. And also thinking about what the audit work plans are. A lot of companies took a pause in 2020 and this year on doing their audits. They just did, because they were focused on, one, cutting costs. Secondly, the Fed and state regulators were taking a pause. So they figure, okay, well, that was a mistake. Everyone has found this out too a little bit, where they found that not having these reviews and keeping people abreast and keeping awareness there and due diligence put them into a very uncomfortable situation dealing with the regulators, state and Fed, on remediating corrective action plans.
Yep.
I don't know if you want to add anything more on that, Lynn, or you go into your next section on that.
I sort of go into the next section.
Okay, good. We'll I think the next page we'll touch in on what is a FTeam. So, so
Next polling question. What is FTeam? First tier entity assessment management, first tier entity auditing and monitoring. It was a new term for me too. So,
okay,
yeah, so it is 50.
Good.
50, yeah,
that's good. And I think that's helpful, because you're hearing some terms, and it's not to be controversial at all. Like, okay, we're throwing a bunch of acronyms at you. It's really for those who are going to think back a little bit. Okay, as I talk with my risk leaders, or even as a risk leader, how do I get folks involved in understanding, hey, we need to have good oversight, good education, and it's not just a checklist item. Because what we're finding as I talk with my current payers and hospitals and even provider groups supporting payers, that first tier entity and managing those assets and managing the communications and managing the IT controls need to be improved. And it's a good exercise. It's not, no one's doing anything wrong. They're doing the best thing they can. They're realizing, oh crap. And it's just, what are the same fatal points that can happen? Well, what's the return on investment in making sure these controls are in place? Well, ransomware is being used a lot, but then also there's a fair point of, if you don't have a good compliance program, a good auditing program, or a good control program in place, what can happen is that you get a corrective action or a corporate integrity agreement where you can't take on any new members or new patients, and that also constrains revenue. So when you think about the ROI of supporting some of these decisions to really hone in on this, there is an ROI of making sure you don't impact revenue, and as a going concern for your organization. And I'll pause there, and I'll let my esteemed colleague Lynn go into her next area.
And just a heads up real quick, there's a 15 minutes to the top of the hour.
Oh, thank you, Kenan. So you're saying,
thank you.
I need to shut up and move on to the next piece. Okay.
Yeah, so, I think this is where we come to the question that Todd and I will both try to answer for you all is, so how safe are we, right? And yeah. I think that it depends on what stakeholders in the healthcare space in particular see as their priorities, right? Currently, ransomware is the marquee issue. It's at the forefront of boards of director meetings, audit committees, and things of that nature. And we see it in the headlines, but phishing attacks are still very problematic for organizations, especially healthcare. And phishing attacks can lead to ransomware. So what we're finding, of course, and I'm sure many of the folks on the phone and who will review this recording know that stealing healthcare data is now viewed more valuable these days than stealing credit card and account banking information. So the ransomware threat, there's a couple of things that you can do to combat it. The first one is the administration released back in May 2021 an executive order on offering guidance on leading practices for being able to thwart and combat ransomware attacks. And so the Cliff Notes version is use multi-factor authentication, right? Because passwords alone are routinely compromised and you can't just rely on that. Endpoint detection. It's not enough to identify when something is going on or there's an anomaly, but you got to hunt for it, right? And I think that's where it's been problematic, is that this then IT department with the skill sets or dedicated individuals that Todd and I have been talking about makes it more difficult to have that kind of constant monitoring for malicious activity on a network. Incident response. Okay, you've identified it and you've got your plan and everybody opens up their playbook and they run it. But in addition to that, you have to have the basic blocking and tackling in place as well. And I can talk a little bit more about that if anybody's interested. Encryption for data and transit at rest. So if data is stolen, it's unusable. And we know that HIPAA requires it anyway, but not everybody is large enough where they've done that fully as they should. And again, we come back to the skilled and empowered security team, right? You need to patch swiftly, patch often, identify those legacy systems that are no longer in use, that can't, they're not supported, because you find a vulnerability, you exploit it. That's one way to get in through the hacking, right? Another we know is the phishing attacks, and of course, ransomware. So, being able to share corporate information about the threat landscape, leveraging business forums that can provide you that, but also incorporate the threat intelligence into your overall cybersecurity strategy. Next slide.
And while you go there too, I mean, the thing that we're finding as well, and why this is critical, is that when we get into the telehealth space and looking at this as a slide talks about, we found that because of telehealth and the cross-state needs for care for folks who decided not to be in their home state, moved into another location because they're near home or near their family members, and getting care, critical care remotely, the e-prescribing rules have really been mandated more so than before. More so it's like, okay, making sure as another way of getting information to the pharmacy, the controls for IT have been driven to really improve on delivery of information for care and the care continuum, either for medical therapy management or anything else that's related to that patient, either from delivery of care, from meds or any other protocols, treatment protocols. And why is it important? Because a lot of things that they're finding is that there are a lot of manual controls that were put in place to support telehealth. So even if you have the conversation digitally, the manual interface between that patient or that individual can be fairly manual through a script as a picture on your phone, and it's not being transmitted correctly to the third party to provide that information, provide that service, be it some therapy, oxygen, drugs, or any sort of PT that's existing, and it's still very manual. So a lot of things are trying to be forced in place to get rid of the manual protocols that do exist currently to support digital care. And that's what we're seeing. Even the gig tech space, even the heals.com of the world that have been struggling with how do you deliver digitally to a home there still needs to be some sort of paper trail digitally to help with on to manage this a little better. But manual interventions also created an increased number of fraud instances too. So the quiet thing we're not hearing in the news, and what you don't see a lot of times too, is that there was a number of instances of fraud that took place during the COVID space because there was several executive orders to make sure people just get their care how they want to do it. So now they're forcing this sort of digital play on delivery of care, communication with the member, with the patient, that's going to drive more and more awareness and due diligence to Lynn's point of making sure IT controls are in place. So what we're saying here on this slide is driving that integration with looking at your compliance plan. So those who may be leaders on the phone or reviewing this later on, understanding what is in your work plan, be it compliance or internal audit. Is it for this year, next calendar year, or even on the roadmap for your controls management space, making sure you have really in there, really clearly stated in those plans, the IT security reviews. So that's really what this slide talks through, and making sure everyone is up to date. You have new people come in from other industries, we saw this a lot in the healthcare space early on during the advent of the EHR system, financial services companies coming in to work in hospitals and health plan systems because of their understanding of highly regulated space. HIPAA and other IT controls made sense, but it's that back and forth. So you have people maybe new to healthcare, but really understanding what it means to have strong IT controls within the healthcare environment. And then reviewing other policies. We found a number of policies that, as Lynn and I looked at, were outdated or cut and paste from other examples on the internet to make sure a IT policy exists. But there's nothing in there that shows that everyone understood it, or it wasn't complete because they're missing the other pieces that should be there in IT. So yes, I'll stop.
I didn't say anything.
Okay.
Yeah, just to add to what you were saying, the policies, whether they were cut and paste or the best or whatever, the fact that they may not have even been communicated to the employees even were aware that they existed. Very problematic. So, among other things, you want your cybersecurity strategy to reflect the evolving threat landscape that we've talked about and the risks that we've seen that have been trending, right? And, I'm not going to walk through all these points because I think we've pretty much underscored most of them, or Todd just addressed, a lot of them on the prior slide. But where there was a rapid response to get or enable your employees to work from home, go back and scrutinize those privileges and access controls. Make sure that the new technologies that were enabled over the last year for responding to the pandemic actually aligned with your IT governance plans, or as Todd was mentioning earlier, with the policies and procedures that have been documented. We talked about third-party agreements, making sure that the verbiage clearly defined just as much for IT and cybersecurity as you would for data privacy all these past years. Get those expectations really ironed out. Start testing for operational effectiveness of your training. Is it working? Is it helping to minimize human error? Look, when there's a phishing attack, people default to what they know and what they've been trained to. So if you're only training once a year or every 6 months with some phishing campaign, I don't think it's enough. I mean, we're at the point where we're saying minimum quarterly, right, Todd? Quarterly.
Yep. We're doing with even our own firm. We're doing that right now. We're publicly traded, so we have to be very careful. I don't know. So yes, absolutely.
Yeah.
Quarterly.
Yeah. And so the more often that you can do it, maybe monthly is too much, but we do have some companies that are doing it monthly, and I think it's helping them, right? So remote workers are going to continue to be a target. The hot cybersecurity skill sets will still be a challenge, for hiring the right people, and increasing the bandwidth of connected devices and Internet of Things are going to become more vulnerable and subject to cybersecurity attacks. So as vigilant as you are and having a plan, making it align to your business mission and investing, I think is going to go a long way to how safe you're going to be in 2022. Todd, any final thoughts?
No, you said it better than me. So thank you, Lynn.
Very good. I think that concludes our presentation for today.
So yeah,
Thank you.
it's a couple minutes before the hour, so I have not seen any questions come in through the chat. So with that, we're going to leave it there and give you 2 minutes before your next meeting, everyone. Thank you, Lynn and Todd, for this. Very informative. Thank you all for participating. We will be, if you have any questions, there's Todd and Lynn's email, as well as if you have any general questions about RGP Healthcare, email us at partners@rgphealthcare.com. So thanks, everyone. Have a great week, and we talk to you soon.
Thank you.
Take care.